Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Today, Stephanie Desmond talks to Pastor Terrace King of Baltimore's Liberty Grace Church of God and Lois Prevost-Dumb, a senior advisor at Johns Hopkins International Vaccine Access Center. They discuss the challenges of building trust for a COVID vaccine in the Black community, which has been hard hit by the pandemic. Let's listen.
Pastor Terrace King and Lois Prevost-Dumb, thanks so much for joining me.
Thank you.
So today I want to talk to you about building trust for vaccines in the Black community. I know that you are working in Baltimore to try to make sure that folks are going to be receptive to a COVID vaccine. I'd like to start with you, Lois, and talk to you about people of color are far more likely to die of COVID, and they also seem to be reluctant to receive a vaccine. Could you talk to me a little bit about what that means?
Thanks, Stephanie, and thanks for having me. You know, it's really funny because you would think that people automatically would want to take a vaccine knowing that they are at higher risk. But we're finding that that's not the case, that there's a lot of distrust and hesitancy within the community. And it may have something to do with the vaccine, or it may have absolutely nothing to do with the vaccine, but a broader issue. One of an issue about politics or an issue about trust in the system and institutions, because there's been such a long history of mistreatment or feeling like you're not taken seriously when you have questions or concerns. So those systemic issues are really problematic in the Black community.
Pastor King, could you elaborate on that a little bit? What do you see in your church community?
I think both within my church community, and thank you once again, both within my church community and in the broader community, one of the things that has been eye-opening for me to some degree is that we're not monolithic. We don't all in this community think the same way. I think to a great extent, the safety and efficacy as it relates to the vaccine in this community is less of a priority than the history and the current treatment that individuals have received in the healthcare system as a real challenge to trust around the vaccine. Folks come in with the code words. They come in with the code words starting out. Don't want to be a guinea pig. Tuskegee, Henrietta Lack. All of these code words in our community draw us together around this issue of distrust. But there are also individuals, because of their jobs or because of their history with the military or whatever, have become accustomed to vaccines. So you get a different perspective. So you can't do a broad brush and say, here's where the African-American community is coming.
Mm-hmm. Mm-hmm. You sound like you're surprised, though, at the level of distrust, given the benefit that could come from a vaccine.
Well, I'm not really surprised, I have to tell you. I think because of my history, both serving simultaneously as a pastor, as a senior executive in the federal government, and establishing the Office of Minority Health in CMS, or the Centers of Medicare and Medicaid Services, I got to see African-American distrust and unequal treatment across the country. I want to make sure, as I describe what I'm hearing and what I'm seeing from folks, it isn't just Baltimore as a microcosm. This distrust is all across the country because there has been a proliferation of unequal treatment of African Americans in the healthcare system forever. I mean, forever. And so we have to look at this population and say, well, of course they would be distrustful. It would almost appear abnormal if we weren't distrustful. It would be very strange for people to have been treated the way they have in hospital systems to say, oh, sure, I trust you now. That wouldn't be normal to me. So I haven't been surprised at all.
So how do we break down these feelings and build trust? Because it's so important right now. I mean, it's so important always, but this particular vaccine is so vital to stopping the spread of this disease.
Here's what I'll do. I'll turn to the other lady on the screen because I think what she's done is set a process in place that for me, I want to say as I hand it off, is not about convincing. It's really about informing. African Americans in my community and across this country that I've seen are intelligent enough if the information is brought to them, if the facts are put before them, to make their own decision. And so I'll be quiet and let Lois take it from here.
Yeah, no, that's so important, is to bring people together in the community, to have a space, and really a safe space, to ask questions, to talk about concerns, and talk about sometimes more than just the vaccine, because people have lives and people have concerns that are maybe overriding some of the concerns of the vaccines. So if you understand what their priorities or what is going on in their daily lives, that can really help in the conversation. Because if somebody wants to talk about, Pastor King told me a story early on about a problem in Baltimore City when they shut down all of the restaurants. And what happens when you shut down the restaurants? Well, there's rats. And when you're coming in, and Pastor King, correct me if I get this story wrong, but if you're coming and talking about vaccines, when rats are going into houses and terrorizing kids, people are just not open to listening to, what you have to say, and recognizing that people have their own priorities and own concerns, and being able to arrive at the right time with those messages, not just talking about what's important to you, but what's important to them, is just so crucial in the process. So I think what we've done is we've taken this to heart and recognized that you have to get to know the community and get to know their concerns first, and then talk about, what is happening in their lives and what their concerns are about COVID-19. That then opens up the opportunity to answer questions. One of the things that we did early on is decided not to say that you should go in and say you should have this COVID-19 vaccine because you're at higher risk. Let's first hear from you what's happening with COVID-19 and understand how much of a problem this really is for you, and answer the questions you have about vaccines, because that just opens up a completely different conversation. One where the community is inviting you in to talk about the vaccines rather than, assuming that you know what their needs are. So it creates a completely different dynamic. Bringing in the partnership of the pastor with the academic community is also something that is really important, because what they want to see is that we not only care about the science, but we care about the person. That, we need to know what's happening in the community, and that we have a partnership that's going to last, that's going to say that we need you to help co-design the solutions, not just give us the answers already packaged up, but invite you to the table and get you to work and figure out what is going to work best in your situation and what is going to give people confidence.
This seems like a lot of work. It seems like a very slow process. And it feels to me, as an outsider, that there isn't a lot of time. So is there any way to move this forward faster, or does it have to be done on such an individual level?
It's very true that it is a slow process, but what you don't want to do is you don't want to win the battle and lose the war. And that's what we're concerned about here. It doesn't take a lot of effort to organize yourself and to reach the communities. Now, granted, we should have been doing this a lot sooner.
That's right. That's the point.
We are definitely behind the 8 ball, but it doesn't mean that you can skip those steps. Because again, we're dealing with people, and people don't want to be told what to do. Some people do, but many people want to come to those decisions for themselves. And we really do need to at least start the process. Now, as imperfect as it may be, we may have to push a little bit sooner than we really want to. But not going out at all and not having all these conversations really risks some long-term negative effects.
So, Pastor King, are you planning to get the vaccine?
So here's where I am. And I think this is a very important place. In order for me to play the role of neutral arbitrator and bridge builder between science and the sanctuary, my position has got to be one that says, yeah, I'm growing a little warmer about it, but I haven't made a decision. And why is that important? Because there are those in my community, in terms of credibility, that I need to stay right here. I need to be neutral. They need to hear more. This process has to be put in place. Let me say, bigger than me as an individual. I'm a servant. And if through this process, having this telecast, if I can bring, in some way be used to bring Hopkins, let's think about it, to my sanctuary and community, that is a tremendous feat. We have one of the most internationally, one of the most respected institutions in the world in our city. Baltimore City and its residents should be some of the healthiest people in the world. Come on now. If I can be that bridge, it's far more important than are you taking the vaccine. I am going to stay neutral because I want folks like yourself and Lois to come on into my world and help me improve the lives and the well-being and the health of the people I serve. It's no longer about me. It hasn't been about me in a long time. It's about the people I serve. And the fact that I have Lois working with me, I believe we can make progress. A door has been opened, and I'm walking through it.
I guess this is really an opportunity to fix all of the wrongs from the past.
Let me say, the big three in my mind are clear. My wife and I took a trip to Africa, and they had the big 5 of animals. Well, the big 3 of disease in Baltimore: obesity, hypertension, diabetes. These are the big 3. Come on now. The literature, the methods, the processes that you're supposed to go through to address these issues exist. So why isn't this happening on a broad spectrum between Hopkins and the sacred space of churches and the communities who trust us, not just because we preach on Sunday, but because we have a history of serving our people? Come on, this is a perfect opportunity. I am a pastor, so I am always accustomed to looking at problems and seeing promise. That is the way I have to look at things. I cannot serve a community that in many cases is at the bottom and see again and again individuals lifted and not believe that something positive can't come out of the pandemic. It already has. You wouldn't be talking to me if it wasn't for this pandemic. I wouldn't be on the line with you ladies. I wouldn't get an audience with Hopkins. Are you kidding me? Are you kidding me? Something already has happened. We have pulled together ministers, some of the most influential from all across Baltimore City, and introduced them to our health commissioner, who did not know them. Something already has happened. And those pastors, fortunately for me, are showing a trust in me in being a bridge with hospital and academic institutions across the city. Now let's take this opportunity to change the health state of Baltimore City.
Pastor King, Lois Prever-Dumb, thank you so much for joining me.
Thank you.
Thank you, Stephanie.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.